Okay, why don't we get started? Welcome, everyone. My name is Megan Corrado. I serve as the Director of Policy and Advocacy with the Alliance for Peacebuilding. Thank you so much for joining us today for this timely discussion on conflict in the time of COVID, not just a second-order issue. As you know, COVID has not only presented us with myriad health challenges, but the political, economic, and social implications are giving rise to increased conflict dynamics around the globe. As you have probably heard referenced several times today throughout PeaceCon, the world is experiencing a 30-year high of violent conflict, which remains the primary driver of violent extremism, causes 80% of all humanitarian needs, undermines development gains, and destabilizes states, regions, and the world. The pandemic could lead to an additional 13 countries experiencing conflict to the end of this year, a 56% increase compared to pre-COVID forecasts. Today, more than 82 million people are displaced, and an estimated 235 million people require humanitarian assistance and protection, about 1 in 33 people globally, and the highest figure in decades. Meanwhile, COVID-19 is proving to be stabilization in reverse. Climate change is compounding conflict and fragility, genocide and mass atrocities are dramatically increasing, mis and disinformation are running rampant, social cohesion and resiliency is breaking down, and technology is expanding the reach of extremists. During a time when democracy was already under threat, the COVID-19 pandemic accelerated democratic backsliding and allowed autocrats to further consolidate power. Unfortunately, despite mounting evidence demonstrating that COVID-19 is compounding conflict dynamics, governments and multilateral donors are not meaningfully integrating conflict prevention and peacebuilding into their larger pandemic responses. The focus has been on health and humanitarian impacts of COVID, while largely excluding peacebuilding and conflict prevention. While there is an understandable and necessary urgency to get shots in arms across the globe, we cannot treat conflict prevention and mitigation as second-order issues. Today, policymakers, implementers, and strategists from the World Health Organization, USAID, Mercy Corps, Cordaid, and Search for Common Ground will make the case for integration of conflict and health programs to successfully prevent and reduce conflict, build sustainable peace, and end the global pandemic. We have an exceptional lineup with us today. Most of them are on the other side of the pond, so we appreciate you working late to join us. Our lineup includes Dr. Maisha Alam, the Special Advisor for Policy and Research with Mercy Corps, Dr. Rudy Konigs, the Head of Interagency Policy for Emergency Units with the World Health Organization, Hilda Daman, the COVID-19 Global Response Lead for Search for Common Ground, Richard Kimball, the Regional Peace and Governance Director with USAID West Africa Regional Mission, and Peter Vancelus, Senior Strategist with Cordaid. Each speaker will present for about 10 minutes, and then we will move into a moderated discussions and take questions from the audience. Please feel free to use the room chat to ask questions throughout the presentations, and we will get to as many as possible at the end. Our first speaker is Dr. Maisha Alam. As I mentioned, she's Special Advisor for Policy and Research at Mercy Corps. She previously served as Deputy Director for the Georgetown Institute for Women, Peace, and Security, and has worked with the UN, World Bank, OSCE, and various NGOs. She's also taught at Georgetown University and New York University. She's the author of numerous policy-oriented books and reports on topics such as women in transitional justice, climate change, armed conflict, mitigation, peacebuilding, democracy, and international law. Her commentary has also appeared in key outlets, including Washington Post, The Guardian, Newsweek, Just Security, CNN, NPR, and elsewhere. Maisha, over to you.
Thanks so much. Can you hear me okay? Okay, wonderful. Well, thanks to the Alliance for Peacebuilding and USIP for the opportunity to participate in this discussion with such esteemed colleagues. Let me first commend you, Megan, and the AFP team under Liz's leadership for the title and focus of the panel, which puts a spotlight on an oft overlooked yet critical issue, which is how the COVID-19 pandemic has been interacting with and impacting conflict, and most importantly, what should be done about it. This is key because, as you acknowledged, Megan, COVID-19 is so much more than a global health crisis. The pandemic is also eroding hard-fought development gains, and the evidence base for this is growing. We know, for example, that the pandemic has increased extreme poverty for the first time in more than 20 years, that it is widening inequalities between the rich and poor, as well as between men and women, both within and across countries, and that it has accelerated food insecurity, that it's posed a seismic disruption to education for tens of millions of children across the globe, and the list continues. However, understanding of how the pandemic is shaping, or rather reshaping, conflict remains limited. At Mercy Corps, we knew that this warranted greater attention, and so we decided to harness our in-house research capacity, along with our in-country presence in many fragile and conflict-affected settings, to undertake an in-depth study of how COVID-19 and pandemic response measures have impacted conflict. For those of you who may not be familiar, Mercy Corps is a global humanitarian development and peacebuilding organization operating in more than 40 countries across the globe. Over the course of this pandemic, we've supported more than 50 million people to protect their lives and strengthen their livelihoods. As I mentioned, we also drew on our strong tradition of evidence-based learning and rigorous analysis, which culminated in a report entitled A Clash of Contagions on COVID-19 and conflict, based on extensive research in Nigeria, Colombia, and Afghanistan. And I'll share a link to that report and its accompanying policy brief with the recommendations in the chat for attendees, and I encourage you to take a closer look. One of our initial motivations for this study was the observation that only counting incidents of violence, for example, as databases such as ACLED, which are very important, do, actually provides an incomplete picture of conflict. So our goal was to understand communities' perceptions, experiences, and aspirations by drawing on in-depth interviews and participatory community workshops with 600 men and women in multiple urban, rural, and prairie-urban locations across Afghanistan, Colombia, and Nigeria, which we did in the first couple of months of 2021. And across our 3 case studies, which are quite different and span 3 continents, we found that the pandemic and response measures have been exacerbating underlying drivers of conflict through 3 primary pathways. First, by diminishing trust in government leaders and institutions. Second, by increasing economic hardship and resource scarcity. And third, by disrupting and in many cases really eroding social cohesion, both within as well as across communities. And a common thread throughout these pathways is that the government has struggled generally to provide services, to maintain a presence in contested areas, and to help communities to deal with the shocks of the pandemic, including health, economic, and social consequences. And as governments have seen their capacity and legitimacy strained throughout the course of the pandemic, a variety of different type of armed groups, including, for example, insurgents, criminal networks, banditry gangs, have really capitalized on the conditions created by the pandemic to expand their spheres of influence. So increased armed group influence has helped to fuel impunity and also in many cases violence, and has increased the risk of conflict and instability more broadly, showing how organized crime and political violence, for example, can influence each other, especially under such difficult circumstances that the pandemic has created. Let me briefly contextualize what Mercy Corps has learned through our research and programming in the wider current global situation when it comes to conflict and fragility. We know from UCDP that armed conflicts are at their highest level in 30 years. This is something, Megan, you alluded to, but I still want to underscore it because it is really important. We also know that this year, the UN expects to support more than 100 million people displaced in more than 130 countries across the globe. We also know that the UN expects upwards of 250 million people across the globe will be in need of life-saving humanitarian support. And we also know that many democracies, both advanced as well as emerging democracies, have been under threat over the course of the pandemic due to rising authoritarianism, declining rule of law, and growing public distrust in institutions. So why does this matter? It matters because any pandemic recovery policy or initiative that does not take into account the complex and concerning ways in which the pandemic is exacerbating conflict dynamics, and that does not comprehensively address the non-health impacts of the pandemic, is simply put unlikely to be effective. In short, the results of our programmatic and research efforts at Mercy Corps are startling, and they're indicative of how the risk of conflict can grow, even if it doesn't produce immediate violence. And I'm sure those at PeaceCon will understand that just as the absence of violence does not equate to the presence of peace, the absence of conflict does not equate to the presence of stability and security. So let me stop there, and I'm happy to further discuss the policy implications and in particular get into some of the recommendations that we've generated during the Q&A. Back to you, Megan.
Thank you, Maisha. And if folks haven't read that report, I would strongly urge you to do so. It's really important and helpful as we think through these really challenging issues. So our next speaker is Dr. Rudy Konigs. He is the head of the Interagency Policy for Emergencies Unit at the World Health. This unit provides the policy guidance and support for operations in disasters and emergencies, coordinates with key interagency bodies, contributes to global policy discussions, and translates policy into practice, and critically is in charge of the WHO's Global Health for Peace initiative. He has worked extensively in humanitarian emergencies since 1983 with Doctors Without Borders, the UN Border Relief Operation, the International Committee of the Red Cross, and of course, the World Health Organization on missions in Afghanistan, Pakistan, Bangladesh, Thailand, Sudan, Ethiopia, Mozambique, Sri Lanka, and Myanmar, and many more. He has also served with the ICRC in Geneva as a focal point for health programs in Africa, as a technical advisor for public health programs, the Health Emergencies and Large Populations Course Coordinator, and as a focal point for tuberculosis control programs in prison. Rudy, over to you.
Thank you very much, Megan. Thank you for your nice introduction, and thanks for inviting the World Health Organization to this talk. Because people, when they speak about health, of course, they think about WHO, but when they speak about peace, a little bit less so. And I would like to convey to the people attending that WHO is very much involved in health and peace and the interaction. Let me put up a few slides to sort of support what I'm saying. And so when I looked at the title on conflict in times of COVID, not just a second order issue, I would go one step further and put to you, is this a crisis? Or is this actually an opportunity? And I would like to argue that this is an opportunity that we have to sort of use for the better. And there's a few things that we have in our sort of in our textbook on this. One of the questions that we sometimes get is that is it true that there are more conflicts now, or we just know more about it? We hear more about it in the news. But when we look at the data, and these are data actually from the World Bank and Swedish Institute for Peace, no, over the last 20 years, there have been an increase in conflicts that's quite dramatic, and all kinds of conflicts, state, non-state, internal, even interstate. So there is a real increase to the point that for WHO, its humanitarian caseload is 80% of its caseload, and 70% of the disease outbreaks that WHO responds to, they do take place in what we call fragile, conflict-affected, and vulnerable settings. So there is indeed more to it, and the health aspects that we deal with happen more and more in conflict-affected areas. So that is certainly the case. Now, 2 years ago, when we heard about this virus that came out of China, sort of out of nowhere, in 2020, we were having discussions, and many people argued, well, by March, we wrap this thing up. By June, at the most, this thing is done and dusted, and we move on. Now, today, there are now 350 million cases of COVID-19 already, 5.6 million deaths. These are numbers that come close to the casualty numbers of the First World War. And as you can see on the graph, it seems like it's increasing, and it's increasing rapidly, of course, driven by the Omicron variant, and very much in the Americas and Europe. So we do have a serious problem at our hands, and a problem that is not yet about to end, I would say. So at some point, we will have to learn how to live with this. Now, of course, we have a vaccine, and so everybody is very happy. Almost 10 billion doses of the COVID vaccine have been administered. But when you look more carefully at the map, you see that, for example, there's 34 countries that have vaccinated less than 10% of their population. And so that's the beginning of a problem already, because also in a number of countries where they do vaccinate, and most countries in Africa, and mostly in Africa, but also in Asia, have vaccinated less than 40% of their population. But quite often within the country, it's not evenly distributed. And so guess who is left out? It's either the ethnic minorities, religious minorities, displaced people, refugees that are usually left out. So we have a potential for conflict there and then. And so within the World Health Organization, we have initiated this Health and Peace Initiative. It's now called the Global Health for Peace Initiative. It's actually being discussed tomorrow at the executive board. And so we trust that our member states, because we are a member state organization, will give us the green light to work even more on this. And there we look at what are the interactions between health and peace, COVID-19, how are they interrelated, so that one thing we learned from COVID, it's not about health. It's really the whole of society issue. And there is no way we can get to the end of this epidemic unless we involve all parts of society in this. Now, in the beginning, we were discussing, and not only us, but the Secretary General, is COVID-19, if this outbreak, is this good for health or for peace, or is this bad for peace? You may remember that the Secretary General did out a call asking for a ceasefire during the COVID. I'm afraid that, although the Secretary General report lists a few successes, but in generally, I don't think at this point we can say that this has led to an outbreak of peace, so to speak. But what we have learned is that we really have to look at the triggers for conflict and which ones are related to COVID. And then, of course, what are we going to do about it? Because that's what we are discussing right now. And for us, one thing that we sort of promote in the Global Health for Peace initiative is to do three things. And it sounds very simple, not to say simplistic, but you would be surprised how many people do not do that when they start programming. And so we asked to do just three things, as simple as that, is to do a conflict analysis. If you come into any situation with tens of thousands, millions of dollars worth of goodies, you are a player in the game. And so you have to know who are you playing with. And you would be surprised how often people simply forget that. Especially health people, I'm afraid to say, because there is this notion we are health people, so what we do is good, and therefore everybody will love it, and that's neutral and independent. Well, no, let me break that to you. No, it isn't. It isn't. So we are part of it. So do that conflict analysis, and then take that into account for your programming. Do a conflict-sensitive programming. So if you move in with whatever health program, be it in Tigray or in South Sudan or in Cameroon or in Afghanistan, make sure that you have taken that into account. And the next thing is, as the World Health Organization or health partners, we want to achieve health outcomes. Now, can we, in addition to these health outcomes, also achieve peace dividends? And that is something that is relatively new to the World Health Organization, but health partners sort of approach that you can actually get the bonus points is if you plan it right, do your conflict analysis and conflict sensitive programming, you can actually achieve peace dividends. And this is what we would like to see our programs sort of contribute to the global peace discussion. So the vision we really have is, can we position the health sector as a contributor to peace through its health interventions? And this is, when you talk to health people, and I presume you all have done that, that's a concept that is remarkably absent in the thinking of many health workers. So that, in that sense, we think we are quite innovative in doing so. And we are lucky that we have a Director General, Dr. Tedros, who is on board with us on this one. And he has said it many times, and he says it again: there cannot be health without peace, and there cannot be peace without health. And that's what the Health for Peace initiative is all about. I put the website on there, but we are working, for example, with ILO and DPP and Interpeace on looking how we can go beyond the current crisis and use that as an opportunity to make sure that at the end of the story, we have achieved something that goes beyond coming to the end of the epidemic, and that we have contributed to the peace building in general. If we can achieve that, then we think we have used this crisis for the better. And so I invite everybody to come and work with us and do that. It's not just about WHO. It's about, we talk for the health sector, but there's other sectors that should be involved also. Let's all together work for peace. That's my message for today. Happy to discuss this further.
Thank you, Rudy. Really appreciate that. I mean, I think you highlight some of the sort of the key themes of this entire conference. We're looking at conflict, COVID, and climate, and too often we all sort of operate in these silos. And so how can we break them down and sort of integrate programming where we're taking sensitive approaches, both, for instance, in health, and then health taking conflict sensitive approaches, and climate, same thing. So really appreciate the work you're doing at the WHO, and great to learn more about the initiative. Our next speaker is Hilda Demant. She's the COVID-19 Global Response Lead for Search for Common Ground. As an expert in conflict transformation and gender, she's been working with Search since October 2014 as country director in Madagascar and later Tunisia and Libya. In this role, she provided strategic guidance and oversaw the implementation of programs in the areas of good governance, youth and women's participation, preventing violent extremism, and civil society strengthening. Prior to that, she worked with UNFPA and Oxfam in the Great Lakes region in Yemen on WPS, human rights, and protection. Since July 2020, she's been leading Search's global response to the pandemic across 10 conflict-affected countries, coordinating research on the interplay between COVID and conflict dynamics, and overseeing Search's interventions to address mis and disinformation, promote social cohesion, and mitigate violence. We've already been talking about some of these issues, so really excited for you, Hilda, to dive in. So over to you.
Thanks a lot, Megan, and thanks a lot for having us partake tonight in this conversation, or this afternoon for you in the US. Maybe just a quick few words. As you mentioned, I work for Search for Common Ground, and we're the largest dedicated peacebuilding organization. We have headquarters in DC and Brussels, and we're present in over 35 countries across the world. We're actually celebrating our 40th birthday this year, so it's a bit of a special year for us this year. And we've been, since the COVID pandemic broke out, we started doing COVID response programming across 10 countries. And in 6 out of those, we've been conducting regular research on how the pandemic is impacting social cohesion. And those 6 countries are Yemen, Palestine, Uganda, Kenya, Tanzania, and Nigeria. So fairly different context. And we've been tracking over time in quantitative ways through survey-based data collection, how the pandemic is impacting people's trust in their government, the satisfaction with the government's response, and also social cohesion, cohesion between groups, horizontal cohesion. The interesting thing is that we have a fairly different approach to the presentation, to the study that Mayesha was presenting, but we come to fairly similar conclusions. And between Mercy Corps and ourselves, we've actually had over the last couple of months a couple of exchange points, and it's interesting to see that we're so much aligned. And I was also just very happy to say, to listen to Mr. Konigs' presentation. I was very happy, and especially that last point in terms of the call for collaboration. I think we couldn't ask for more from our end. I think in terms of my key messages, I wanted to focus on a couple of key points that we found through our research. And I may be stating the obvious for some of us in the room, but I feel it's just important to repeat that. And I want to start by focusing in on the issue of trust. Trust is a very rare commodity in conflict-affected countries, especially among groups who have been discriminated against, who have been marginalized, and who have faced serious violations by their own governments. And I think that is something that is gravely underestimated in the pandemic response in a lot of places. the issue of trust in authorities. And I think it's crucial that we get a better grasp on that, because this goes beyond issues of trust in the vaccine. It goes beyond issues of trust in the health system. This really is about trust in the state. And this is about how do you work in conflict-affected settings with groups who have a history of discrimination and who have, in fact, direct experience and very genuine reasons to distrust their government. So how do you then roll out a vaccination campaign or a pandemic response in these type of countries where you know that certain pockets of the population will resent anything that comes from the government? And this is very acute in conflict-related contexts. But we're in fact seeing that across several minority groups. I live in Brussels. I can tell you that some of the most vaccine-resistant groups in Brussels are people who have had bad experiences with the government. I think we shouldn't be. I think we should be honest about it, and I think we should put that more front and center in the public health response. And I think it's also up as peace builders to engage in a better conversation with the global health community around that issue of trust and around the fact that this is more than just mis and disinformation. This is more than just doing effective vaccine communication campaigns. This is really about how do you rebuild trust. And as peace builders, I think we have a lot of experience in terms of what does it take to rebuild trust. I think we should also, trust sometimes sounds like a pretty intangible thing, but trust is actually something that you can measure and you can track it over time. And for example, one of the interesting things that we found in our research, we clearly see a correlation between people's satisfaction with services and their level of trust in the government. And what was interesting, what we've seen over time is then when we started out our research in the 6 countries, we saw that among women in the 6 countries, they tended to have higher satisfaction levels with the services that were being offered by the government, and they were also having higher trust in their government's response. But that has changed over time. We've now seen, after 3 or 4 rounds of research, we've seen considerable increases in men's trust in the government and in men's satisfaction with COVID response services. And we've seen a stagnation among women, or we've seen even a drop in satisfaction and a drop in trust in the government among women. And for us, that is an indication that in a lot of these places, the government response is not taking enough into consideration women's needs and women's priorities. There's probably just in a lot of these places not enough women who are even part of the pandemic response and who are taking decisions around pandemic response at the national or local level. And so we're losing a lot of these women. And I think that we shouldn't underestimate also what does that mean for women's well-being? What does that mean for their families' well-being? What does that mean for societies over the longer term? One very interesting example of that, a very good illustration, was something that we heard from our team in Uganda, where the government had, in the beginning of the pandemic, provided in-kind support to families. So access to food, access to medication, etc., which is something that the women overall were quite satisfied with. But then over time, as the pandemic progressed, the government shifted to cash support to families, which then was something that the men controlled, and the men got to decide how the money was spent. And in that way, the women lost a lot of control, and the women felt that the government was actually disserving them and disserving their needs. And so those are some of the key points that I just wanted to make. And I think that the last point that I'll just make, and I think there's much more that we can discuss, but I kind of want to build on what Mr. Konigs was saying about that opportunity for actually creating peace dividends. I think that is such an interesting point to make. And I think it's really an opportunity that if we get this right, and if we're actually able to use a global health response to rebuild trust and do that in a way that we reach some of these really hard to reach communities, this is going to reap benefits for societies in a much longer term. And this is going to rebuild trust, and is going to rebuild relationships that will, just in general for peace building, are so crucial in many of these places. And I'll keep it to that. I'll put in the chat box also the link to the reports that we've been putting out. So we've been doing country-specific reports for the 6 countries that I've cited. We've done 3 rounds so far, and we're going to put out the 4th reports in the next couple of weeks. And then we've done a couple of thematic reports as well, and I can speak more to that later in the conversation. But I'll keep it to that for now. Thank you.
Thank you, Hilda. Yes, please do share those resources. Again, I'll make a plug for you. If you haven't read them, do. It's so important and really helpful to understand sort of the different dynamics and different contexts. So I really appreciate you and your team for your work there. So our next speaker is Richard Kimball. He's the Regional Peace and Governance Director with USAID West Africa Regional Mission. He previously served as the director of the Office of Democracy, Human Rights and Governance for the Democratic Republic of Congo, and as a member of the Governance and Rule of Law team with USAID CRG Center in Washington, D.C. From 2010 to 2012, he served as the senior USAID representative on the UK-led provincial reconstruction team in the Helmand province in Afghanistan. He also served as USAID Field Transition Advisor in Kabul from 2012 to 2013, and as a General Development Officer with USAID Malawi from 2003 to 2009. Prior to joining USAID, he worked with USAID-funded implementing partners in West Africa in a variety of positions, including Chief of Party, and started his development career as a small enterprise development Peace Corps volunteer in Guinea in 1990. Thank you so much, Richard, for joining us. Over to you.
Thank you, Megan, and I would like to thank the organizers of PeaceCon for inviting USAID to participate in this important event. It's a pleasure to be here today and participate in this panel with my esteemed guests. In my remarks, I'm going to briefly address the following three topics: the impact of the COVID-19 pandemic on USAID West Africa's regional peace and governance programs, the adjustments we took to mitigate these impacts, the trends that we and our implementing partners are seeing in terms of the impact of the pandemic on conflict and democratic backsliding in West Africa. And I'll finish by providing a few examples of how our regional peace and governance programs are addressing some of these effects of the pandemic. USAID West Africa implements regional peace and governance programs focused on conflict prevention and response, preventing and countering violent extremism, and strengthening democratic governance processes in the region. To date, these programs have focused primarily on the Sahel and the Lake Chad Basin, with targeted activities in select countries in coastal West Africa. Like many of you, from an operational perspective, adapting to the COVID-19 pandemic required swift changes for our USAID-funded regional peace and governance programs. Likewise, our partner-led peacebuilding programs in conflict-affected countries had to adapt to an increasingly difficult operating environment. The onset of the pandemic initially brought many of our regional peace and governance activities to a near standstill. Field work delays and unexpected changes in key personnel due to COVID-19 resulted in work plan revisions, which further slowed activity implementation. These difficulties were further compounded by many already existing operational challenges, including limited internet access and weak power networks. And remote work created its own challenges in collaboration, convening, programming, and monitoring and oversight. This proved particularly challenging for new activities and new staff who have had to be brought on board and to develop professional relationships in a completely virtual environment. Some of the measures that our local partners took in the face of the pandemic, including mandatory mask wearing, social distancing, holding activities outdoors, and reducing meeting or training sizes, splitting training sessions into smaller groups, among others. Government implemented COVID-19 precautions and restrictions, slowed grant implementation, and some activities had to be adapted from their original design. The high risk of COVID infections associated with travel continues to affect the frequency of field visits for financial and program oversight and our regional support and technical services, all of which poses an increased risk of poor implementation and malfeasance. The fear of the spread of COVID-19, the emergence of new variants, and lockdowns and other restrictions in the region continue to require adjustments to remote implementation of activities amid the evolving COVID-19 protocols. For USAID West Africa's Regional Peace and Governance Office, our COVID-19 strategy over the last year was to try and address some of the secondary effects of the pandemic, such as democratic backsliding and the closing of civic space, and to pursue an integrated approach that puts peace building and conflict prevention at the center of these efforts. Some of our regional conflict and prevention and peace building programs adopted COVID-19 program into their regularly scheduled activities, particularly around COVID-19 awareness initiatives and countering disinformation and misinformation, including addressing extremist messaging and rumors presenting protective measures as anti-Islamic. Looking at the democratic governance trends in West Africa, democracy was already under threat in many countries in the region before COVID-19. However, we believe that the pandemic exacerbated democratic backsliding and provided autocratic regimes room to further consolidate power. In West Africa, we've seen some political leaders exploit COVID-19, either to solidify power or to restrict public space through postponing elections, crackdowns, arrest, and consolidating power. Similar conflict situations were observed, for example, in Guinea, Togo, and Benin, where reports that indicate repressive measures were carried out against political opponents using COVID-19 as a justification. In addition to democratic backsliding, anecdotal evidence and analysis seem to indicate that the pandemic contributed to increasing instability and violence, and exacerbated dynamics in conflict-affected and fragile states. For example, conflicts between states and armed groups and attacks on civilians have escalated in most parts of West Africa. Armed groups and violent and extremist organizations maintain a strong foothold in the Sahel and Lake Chad region, attacking civilians in Burkina Faso, Mali, Niger, and Nigeria, and attempted to exploit slow or muddled government COVID-19 responses. Our most recent research data, as well as data from open sources such as ACLID, indicate that the security threat is moving further south towards coastal West Africa. In response to these increased threats, we have seen some state security forces in West Africa resorting to heavy-handed responses, including alleged human rights violations committed against civilians, which has only amplified existing grievances of the local populations. As a direct result of these security and conflict dynamics, it has become even more difficult to persuade local populations with limited or declining trust in their governments and political leaders to follow restrictive public health directives in response to the COVID-19 pandemic. This is why our conflict prevention programs in the region were adapted to integrate a significant amount of COVID-19 awareness efforts. Furthermore, because these types of programs typically focus on bringing people together, face-to-face, and fostering dialogue amongst and between social groups, our conflict prevention and peace-building efforts were particularly affected by COVID-19 travel and other restrictions, including limited in-person interactions and transitioning to a virtual working space. Although our implementing partners and local non-governmental organizations are adapting by moving to digital formats, these dynamics continue to require shifts in their peace-building practices. This comes with some opportunities, such as the possibility of engaging with larger audience virtually, as well as some associated risks. In terms of risks, we have seen a lower level of participation of marginalized groups in some of our programming as a result of working in a predominantly virtual format, which is not the most effective peace-building practice at the community level. Furthermore, lack of in-person engagement is contrary to some of the local customary conflict management practices in West Africa, where traditional and religious leaders are seen as prominent figures in mediating disputes and are often perceived as leaders with wisdom to navigate the negotiation process. Therefore, our programs practice safe standards to distribute messaging and protective equipment and use media to share information on COVID risks and preventive measures. An effective peace-building practice in West Africa requires an in-person engagement. To wrap up my remarks, I would like to offer just a few highlights of how our regional peace and governance programs are addressing some of these secondary effects of the pandemic. USAID West Africa continues to review and implement changes to adapt to the COVID-19 reality, as well as balance both an in-person and virtual presence through our regional conflict and prevention peace-building programs. Recognizing that misinformation and disinformation play a significant role in escalating conflict and contributes to democratic backsliding, USAID's Reacting to Early Warning and Response Data program facilitated digital literacy and disinformation training for youth across the ECOWAS member states, which addressed the risk associated with online operations and online data. This allowed our stakeholders to review West African examples of cases of misinformation and disinformation centered around COVID-19 pandemic and used the Nigerian farmer-herder conflict as a case study, for example. During COVID-19, our programs also used traditional and social media and information, education, and communication materials and approaches to communicate to a wider audience and prove safer and effective in promoting peace messaging around elections and COVID-19 mitigation messages. Our efforts also introduced journalists to concepts of digital media, and how they can use open source data to verify information and detect disinformation that both contributes to driving conflict dynamics and exacerbating the lack of trust in government's COVID-19 prevention efforts. For example, in Cote d'Ivoire, most people in the border communities believed that COVID-19 was imported, and an anti-foreigner sentiment quickly developed. To help respond to this issue, USAID implementing partners conducted awareness campaigns to address COVID-19 stigmatization of foreigners in border communities and to help mitigate intercommunal violence. These are just a few examples of the work that we're trying to do to mitigate these secondary effects of the COVID pandemic, and I look forward to discussing this in the Q&A. Thank you very much for your time, and back to you, Megan.
Thanks so much, Richard. Really helpful to get a better sense of the tangible challenges you're facing in implementing your programs and how you've adapted. Which has been no easy feat, but we really appreciate learning more about that. So our next speaker is Peter Vancelus. He's a senior strategist with Cordaid and coordinates the civil society platform for peacebuilding and state building, the CSPPS. It is a global network of civil society organizations supporting peacebuilding efforts in fragile and conflict-affected settings. The platform provides strategic assistance and support to in-country interventions to amplify the voices of civil society in policy dialogue and peacebuilding processes, and to elevate the YPS and WPS agendas. At the global level, the CSPPS coordinates advocacy efforts around the role of civil society in conflict prevention and peacebuilding. Before joining Cordaid, Peter held various positions in international organizations, including the UNDP, the International Union for Conservation of Nature, and the World Wildlife Fund. His work ranges across peacebuilding and conflict resolution, governance and inclusion, development aid policy, capacity building, and knowledge management, and environmental management. Thanks so much for joining us, Peter. Over to you.
Thank you, Megan, and I hope you can hear me loud and clear. And thanks also for the interventions of the previous speakers. I think a lot of important matters have already been said and addressed, so my intervention will hopefully reinforce some of the earlier points made, and maybe also adding the perspective from both Cordaid and in particular the Cordaid coordinated civil society platform for peacebuilding and state building. As you already said, I mean, CSPPS is a global network of civil society organizations with a focus on supporting local civil society efforts and local peacebuilding efforts in fragile and conflict-affected settings. Through our work, we try to support in-country interventions to amplify the voice of civil society in political dialogue processes and also in peacebuilding processes. Whereas you also already mentioned, special attention is given to underrepresented groups, youth and women agendas in the countries where we are active. At the global level, the international platform coordinates lobby and advocacy efforts around the role of civil society in peacebuilding and conflict prevention. Now on the topic of our conversation, allow me to focus first on what we have done as the civil society platform in response to the pandemic. And then afterwards, I try to formulate also a call to action and building up some of the points that have been made by the other speakers earlier. This call to action will address what more can be done and what should be done, also in safeguarding peace in the times of a pandemic. So now first on the reports and the impact that we have seen locally. And it's interesting to see the presentation from both Mayesha and Hilda. We all have done research in various countries and in various ways, but indeed also here the findings are similar, which you will see. Since the onset of the COVID-19 pandemic, we have kept in close contact with our members of our network in the over 40 countries where we have presence. To learn about the impacts of the pandemic on the local context. And we ensure to stay up to date on the aggravated challenges and accomplishments they faced. Not only in battling the pandemic, but also in terms of the wider impact of COVID-19 on their statuses of conflict or post-conflict fragility. In 2020, these findings were first bundled in the report Fighting COVID-19, Building Peace, a Civil Society Perspective. This publication, I will share the link later, documented what local peace builders say about COVID-19 and how it impacts on the civic space, fragility, and the drivers of conflict. Through that report, we hope to alert the international community to the increased need for global solidarity, and also that the importance of speaking about peace, how peace is impacted and how longer-term development is impacted, and not to see the crisis only as a health crisis. In follow-up to that report issued, and together with our partners in the International Dialogue on Peacebuilding and State Building, we subsequently issued a joint statement on the importance of safeguarding peace during the COVID-19 pandemic. This international statement, together with governments of fragile and conflict-affected countries and donors working on fragility, conflict, and violence issues, also supported the UN Secretary General's call for a global ceasefire. This was earlier referenced by Rudy. Indeed, it took a while before the international community started to realize that this call made sense and that it was important that countries could respond to the pandemic and not were having different agendas to take care of. And hence the call and the support for the global ceasefire called by the Secretary General. 1 year in the pandemic, in around summertime 2021, upon seeing that both the work of the platform and that of local peace builders remained sharply impacted, we issued a second report because we saw that the recommendations given in the earlier report, but also the situation on the ground was not severely changing. The second report had a title called Persistent Impact, speaking of indeed an urgent call again for a conflict-sensitive approach to the COVID pandemic. This report identifies a number of persistent trends that remain unattended and need still urgent and concerted action from the international community. One of the major pressure points we identified is, and what was already referenced also by a previous speaker, is the shrinking of civic space. Our members across the globe reported severe increases in human rights violations, such as the excessive use of force and violent repression during the enforcement of sanitary measures. Furthermore, although in some cases, inclusion in meetings was improved due to the being online and going virtual manner of working, but we still notice the exacerbation of already existing digital inequalities. The lack of stable connections to the internet or electricity created a wider gap in terms of economic, social, and educational activities. Another major area of concern was the lack of good governance in crisis. The pre-existing issue, and also this has been touched upon, of mistrust towards the government has multiplied in times of COVID-19, mainly due to the growing inequality among communities and increasing poverty. The poor management of vaccination campaigns and the lack of transparency of information regarding the pandemic response. Not only does this mistrust affect the response to COVID-19, it also makes it more difficult for civil society organizations to foster social cohesion and to engage with local communities, or being asked to support local campaigns to address the pandemic impact. Another issue highlighted in the report is the lack of resources to protect populations against COVID-19. This is linked to, of course, the reality in which the platform works, linked to the fragile and conflict-affected settings, where there was limited access to soap, water, face masks, and when available, they could cost up to twice a person's daily income. I mean, that is not really how we can address a pandemic that is unfolding. Moreover, many of our members flagged that an increase of domestic and gender-based violence was a great concern in their own settings, and noted the disproportionate impact of the pandemic was having on women. Last point I would want to mention from the report is that most of our survey respondents and most of our members addressed the reduced aids and capacities as one of the biggest, if not the biggest, challenge since the beginning of the pandemic. Considering that finding funding was already difficult for civil society organizations and local peace builders in particular before the outbreak, we as a platform now also experience the same issue. In this time of prolonged global crisis, we feel that we should do more in supporting our members of our network in their fragile settings. But instead, we also find ourselves struggling to stay afloat ourselves. Funding resources for local civil society organizations, and particular local peace-building organizations, are scarce. So let me now traverse to a call to action to both policymakers, but also maybe the donor community at large. Even though evidence demonstrates that COVID-19 is compounding conflict dynamics, governments and multilateral donors are not meaningfully integrating conflict prevention and peace building into their pandemic response. We need to finally start approaching this pandemic in a holistic way, because by focusing on halting the spread of the pandemic, donors have reduced funding towards peace building. Peace-building efforts are intrinsically linked to post-pandemic recovery, and funding for these activities should be combined with other developmental efforts in order to truly build forward better. So reorienting too many existing resources towards health risks, creating grievances and exacerbating tensions within and between communities who rely on aid to meet their basic needs. This reprioritization of funding and programming should allow for existing peace-building initiatives, addressing drivers of conflict or violence and conflict to continue, as they can contribute to minimizing and mitigating the risk that conflicts will be exacerbating by COVID-19 or by any new pandemic that will be upon us. With new COVID-19 funding streams, donors should ensure that funding strategies are informed by context analysis and take into account the longer-term effects of the pandemic and new needs that will arise as a consequence. We need to better prepare communities to effectively respond to emerging crises, including local CSOs and community members in strategy development, ownership, and a more flexible procurement mechanism to promote local ownership and maintain that engagement through a mutual accountable relationship. The CSPPS platform, as the civil society arm of the international dialogue on peace building and state building, knows firsthand how valuable it is to be directly involved as equal partners in a political dialogue process. State and non-state actors, interaction and collaboration is what is needed to counter all of the aforementioned issues that our vast membership have flagged. We are about to start a third year of the pandemic and are another year closer to 2030. Yet, despite the repeated calls from civil society and flagrant need for global solidarity, we seem to be catapulted away from our common sustainable development goals. We are in fact leaving everyone behind. In order to tackle this pandemic, we need a cross-sectoral and multi-stakeholder response. And not just in words, but in actions. We are 2 full years in and far from relief from this pandemic. It is time for true solutions and solidarity, investments for the future. So on behalf of our 800 civil society organizations in fragile settings that are part of CSPPS, I urgently ask those listening for your immediate support. First of all, civil society needs to be included in the necessary conversations around these interlinked issues. And secondly, and even more urgently now, this pandemic has been wearing us down for 2 years already. Civil society, in particular local peace builders, need support and need their funding arranged to be able to do what they need to be done, what needs to be done. We need to be able to recover from this pandemic in a holistic way towards a more peaceful and sustainable world. So a clear call to action here. We all need to step up our game and let's get this done. Thank you, and also happy to answer any questions.
Thank you so much, Peter. Really appreciate your comments. So let's move to some questions. We've had a couple really good ones come in through the chat. I'd encourage folks in the audience to keep them coming. We also have some other issues we want to sort of drill down on. But I think I will take an audience question first. So Bob Berg, the past chair of AFP, thank you for your question. He asked, how would you shape a COVID program to enhance peace? Is there an example, even on ongoing programs, that show promise in terms of peace? So maybe Rudy and Hilda, you can jump in on this one.
Right, thank you. No, that's a very good question. Especially, well, we get this question all the time. Also, how do you measure that you actually have an impact, which is not so easy. First, let's be clear that we are talking about peace with a small p, about social cohesion, trust in government, not about the big peace with a big P, the political peace. And so the activities we do to enhance social cohesion and to provide trust in governments, we have a number of examples actually where we work on these triggers for conflicts. For example, when a country in Latin America tells us, look, for the COVID vaccination, we have not taken into account unregistered migrants in the country. We haven't. We go and talk to them and we take them to task and we say, look, not only we think you should take them into account, trust in government, but also we can make the COVID vaccines available through the COVAX program that has a humanitarian buffer. So we go out, discuss it with them and help them in making it happen. Or if, like in Burkina Faso, when the families of demobilized soldiers are given the task to make masks, it's not only an income generating project, it's also a project that helps integrating these families of ex-combatants to integrate more peacefully in the society, make amends for whatever they are perceived to have done wrong, and integrate them in a more peaceful society. So yes, there are a number of projects that we have, that we look at, and we are on the lookout for things like this. What are the actions that we think will trigger conflict, will exclude people, and therefore is a trigger of conflict? And how can we then help to turn that into a capacitator for peace like in the case of the COVAX vaccine, by making the vaccine available for this particular topic. So yes, there are a few examples that we have, and hopefully more to come.
Yeah, thanks, and I'd be happy to perhaps add a few more examples. First, to state, we're Search for Common Ground is a peace-building organization, right? We're not a public health institute, but I do think that there's ways that we can engage with public health responders to make, as Mr. Konigs already referred to, either their programming more conflict sensitive, or to even go one step further and actually reap peace dividends. And maybe as a first example, there's ways to do covert response programming that is completely conflict insensitive and that can actually create violence and violent outbreaks. And there's ways to do that in a way that will avert that. One example of that is something that we've supported with our team in Kenya, which, like many of the countries that we've already talked about, in the first instance went in a very heavy lockdown, and where we saw a lot of instances of police violence to impose lockdown measures. So what our team and partners in Kenya then did was to put in place a type of early warning systems where we had like very different layers from the very community to the county and then the national level, where we would bring together civil society representatives, police representatives, public health workers, Ministry of Health authorities, local authorities, etc., where every week we would look at, for example, what were some of the local tensions that were coming up around some of these very strict measures, and what could be done to address them, what could be done to kind of avert some of the violence that we were seeing. And we clearly saw how that in the counties where we were implementing that early warning system, how that led to a decrease of violence, and how it also just led to a better understanding on the side of the police of how to engage with these populations, and how to make sure that the population better understood the importance of adhering to the measures. So that definitely had an impact, and in that sense was able to avert some direct violence as an outcome of the COVID programming. But there's other ways that I think we can go one step further, and there's ways to do public health messaging that would at the same time promote social cohesion messaging. And an interesting example of that is something that we've done in Western Uganda, where we've been doing programming in areas around the refugee settlements. where we saw from the beginning that the pandemic and some of the strict lockdown measures were having a negative impact on relationships between the refugees and the host communities, because there was just more pressure on limited resources. People had less space to move around, and so they were more having to go to the same type of firewood, water, etc. And we're seeing increased tensions. So one thing that we did then was partner with the local health structures and with the local radio stations to promote messaging around social cohesion and demonstrate to each group how the pandemic was impacting also the other groups, right? Like how are the refugees suffering from some of the measures that the government was taking, but also how are the host communities affected? And it was just creating increased dialogue. It was creating increased understanding. And in that sense, we can actually promote social cohesion through some of these public health campaigns. And maybe there's a last example I'll cite, and it kind of touches up, somebody else was asking, what have we learned from Ebola? I think another way that we can engage with public health actors is, for example, by ensuring access. I think in a lot of places where we work, peace builders have good access to hard-to-reach communities. In some of the places where we were working in Sierra Leone during the Ebola crisis, health workers were very simply being rejected by communities because they were not from those local communities. They did not understand the local customs. So what our teams then did was engage youth from those communities and have them work and have them accompany those health workers, so that the messaging would come from the right people that they would already trust, and hence the public health response would also be able to reach some of these harder to reach communities. So those are some of the examples that I can cite, but I think it's a lot about how do we build that relationship with the public health responders. And I think, to be very frank, I'll speak for myself, but it's something that I've observed in many of our peace building organizations. I feel over the past 2 to 3 years of the pandemic now, I think a lot of what we're discussing today is understood by many of us in the peace building sector, but it's still a harder nut to crack when we engage in a conversation with public health experts, because they just have very different concerns and priorities from us. And I totally understand that. So I think that there's also an exercise that we need to do to just better engage in a conversation with the public health sector. Stop there.
Thank you both. Really, really important points. And that sort of leads me to more of a 30,000-foot question. How can policymakers, donor governments, institutions comprehensively and holistically integrate peace building and conflict prevention into their health responses, both in the short term and long term? And then, what kinds of foreign assistance and programming can most effectively address some of the issues we've identified throughout this conversation? The rising tide of backsliding, the fraying of social cohesion, economic grievances, closing civil space, et cetera, that we've seen proliferate over the last 2 years and all lead to increasing conflict dynamics. Maybe Richard and Maisha, you could take a stab at this one.
Sure, I'm happy to jump in, and thanks, Megan, for that question. We were glad to see that the U.S. government published its global COVID-19 relief and recovery framework. And within that, the overarching objectives address both health and non-health impacts of the pandemic. However, Objective 4, which specifically relates to humanitarian, fragile, and conflict-affected settings, has neither been adequately funded nor prioritized. And this isn't just an oversight. It really undermines follow through on commitments to promoting human rights and democracy and bolstering peace. It also contravenes the spirit of and strategies that are articulated in the Bipartisan Global Fragility Act, as well as the Bipartisan Women, Peace and Security Act, amongst others. So, we need, much more transparency on what's been funded where with respect to that Objective 4. And while the periodic fact sheets from USAID are really helpful, they don't provide sufficient information in terms of, what funding has been allocated where, what funding remains, what funding is future funding is needed. And this in turn makes it more challenging for implementing partners that are doing humanitarian and peace building work. So I wanted to kind of make that, as you put it, 30,000 feet, ask, if you will, in terms of a need or a recommendation. But more specifically, with respect to some of my earlier points on how COVID-19 has exacerbated conflict dynamics, We recommend that donors, governments, and practitioners integrate conflict prevention into COVID-19 relief and recovery efforts, and prioritize conflict prevention as part and parcel of addressing the pandemic's impact and rebuilding after it. Let me say that again to underscore a point. Just as all conflict prevention and peacebuilding programming must integrate an understanding of COVID risks, all COVID-19 programming should integrate conflict sensitivity. And so relatedly, we recommend that donors, governments, and practitioners consult with and engage directly with communities in order to ensure that policies and programs are not just conflict sensitive, but that they really reflect the realities that communities are experiencing. We recommend, that conflict prevention and peacebuilding approaches are adapted to anticipate, track, and address various types of conflict and risks of violence. And again, this is something that I and other speakers have touched on over the course of this conversation. So whether that's intercommunal conflict, anti-government conflict, or whether that's, gender-based violence within the household. And maybe the most important thing on this is, in terms of looking forward and what Rudy so eloquently put earlier in the conversation of harnessing the opportunities in front of us, we recommend that donors, governments, and practitioners move away from a reactive approach to conflict, one that primarily treats its symptoms, such as violence, towards a preventive approach to conflict, one which focuses on root causes and prioritizes peace building. And that brings me to the second part of your question, Megan, which was about distrust, democratic backsliding, and how does that relate to the pandemic? After I'm done making my point, I'll hyperlink another report that Mercy Corps undertook last year called Overcoming the Trust Deficit, specifically on this set of issues. But maybe the most important things to say are, building public trust for COVID-19 vaccines will be severely hampered by misinformation and disinformation. And this is spread through traditional methods like word of mouth, as well as online methods. And we know from our programming and our research that more people are spending time on social media and online, especially during lockdowns and quarantines. And, we also know that to deliver, we know from experience, including our experience responding to Ebola, just how difficult it can be to deliver public health campaigns where governance is weak or misinformation is rampant and public mistrust is high. And when that's happening against the backdrop of democratic backsliding, the challenges are all the more significant and need, really concerted attention. I think one programmatic example that I'll highlight, or a couple that are highlight of what's working, is, for example, in Nigeria, Mercy Corps undertook an innovative program on rumor tracking to basically identify sources and content of misinformation and disinformation, and then to counter that messaging, not just to, clarify the facts, but counter that messaging. For example, as I was mentioning earlier in my comments, there have been, people spending more and more time online and are socially isolated, and we're seeing negative trends when it comes to social cohesion. One of the things that we've done is to harness technology, including radio, mobile phones, text messaging, to deliver, curriculum and schooling for students who are not able to make it to school. So those are just a couple of examples in terms of both programmatic, what we're doing and what's proven to work, but also, as you put it, Megan, kind of what are the overarching recommendations and needs that we have, especially from donors and policymakers.
Thanks so much for that, Maisha. Richard, would you like to jump in and maybe discuss the ways in which, you outlined, really critical adaptations your folks have been making in the field. So even though, 2 administrations in the United States have released COVID strategies that didn't necessarily prioritize conflict prevention and peacebuilding, was sort of secondary to the humanitarian health issues. So would just love your intervention here.
Great, thanks. I think in conflict-affected countries, and I would like to echo Maisha's comments, and also strongly recommend that conflict prevention and peacebuilding efforts should definitely be incorporated as a cross-cutting element for all development and humanitarian assistance efforts, whether that be health, economic growth, resilience, climate change, or democratic development. I think, and this is that recommendation for me is also built on some recent research that USAID West Africa and our assessments that we've done in the Sahel and coastal West Africa, which have found that many of the main drivers of conflict and violent extremism in the region include government corruption and lack of public service delivery, frustrations about lack of economic opportunity and jobs, especially for a growing youth population, perceptions of marginalization and political exclusion, and human rights abuses perpetrated by state actors, all of which contribute to deteriorating legitimacy and the lack of trust of the state vis-a-vis its citizens, which were an issue raised by multiple panelists today. I think it was noted by several representatives that how a government responds to the COVID pandemic can either help to enhance its legitimacy in the eyes of its population or exacerbate the drivers of conflict highlighted above and create opportunities for violent extremist organizations or other malign actors to mobilize populations around these grievances. So as such, I think donors and other implementers can integrate peace building and conflict prevention into their COVID-19 responses by, for example, helping host governments and civil society organizations to incorporate principles of democratic governance, participation, inclusion, transparency, and accountability in their responses to the pandemic. For example, such programs could include communication and outreach programs to ensure that all elements of society are aware of and have access to the COVID-19 response, including traditionally marginalized groups. Programs could also collaborate with civil society organizations to track the budget allocation and spending of COVID-related funding to enhance transparency and hold governments accountable to its citizens. These are the types of programs can help contribute to broader peace building efforts and reinforce the social contract between the governments and their citizens by addressing these various sources of fragility. And this is exactly what the new U.S. strategy to prevent conflict and promote stability, which is there to help implement the Global Fragility Act, is all about. So back to you, Megan.
Thanks so much, Richard. Just want to flag a question that we received in the chat from BC Dallas. I think we lost her, but she's an old colleague and worked for USAID for a long time. So wanted to make sure we got this question in here. And some of you sort of alluded to it already. But just in some of your research and your programming, what lessons have you been able to glean from the response to Ebola, particularly in tackling dis and misinformation and social cohesion issues? Rudy, maybe you want to jump in?
Yeah, with pleasure. From the policy point of view, one of the messages that we have to get across to our policymakers that, especially for health programs, that quite often health program is not about health. It's about something else. And the messages that we give, it's more about who gives that message. Can we trust this person? And that's not just an African problem. We have seen this in the United States also. So what we learned from Ebola, for example, is that, I mean, the health people, they see this it's very simple in a way. You have a disease that you have a diagnosis that you can do very quickly. You isolate the patient, you give a treatment, which is actually a very good treatment. It's fairly effective. And now you have a vaccine that is very effective. So you vaccinate contacts and contacts of contacts. How difficult can it be? Well, very difficult, as it turns out, because it is not so much about that we have the tools to deal with this epidemic, but how is it perceived? Who brings these tools? And can we trust the people who tell us that this is the right way to do it? We see this in Ebola, but also in others. So nowadays, when we deal with Ebola, we do have an anthropologist in our team to look at these issues. We have learned that lesson. And the misinformation on COVID, we have a whole team now looking at this, what we call this infodemic of information and misinformation, and try to counter that by providing a number of informations that are explained in a simple way and also in languages that are not normally sort of available. So today, with the help, there's an organization, there's not only Doctors Without Borders, there's also Translators Without Borders. So nowadays, if you want the message in Wolof or in Lingala or in Burmese or in Laotian, that can be provided. So we try to counter that by providing good information. Now, this is a bit of an uphill struggle, especially as the evidence-informed information you have to do that while the evidence is changing. And there's a lot of difficulties that to nuance that message. But we have learned from Ebola. That health is not about health only, and that the issue is trust. Who gives the message? Trust in government. These things, you have to take them into account. And then we come back to our conflict-sensitive approach to any program, and I would say especially a health program.
Thanks so much, Rudy. Peter, do you want to jump in?
Yeah, thanks, Megan. And maybe to fully underscore what Rudy just said, I mean, the importance of taking lessons of previous crises, and also what we have done from the Ebola crisis, is that the inclusivity of first responders, and which are often local civil society actors on the forefront of a crisis emerging, is of key importance. That inclusion will also help to safeguard the trust in authorities to respond to a crisis emerging, but also the way the response is then being channeled in subsequent follow-up actions. A lot has been said about trust and the importance of trust, and I think what we have seen earlier with the Ebola crisis hitting the West African region was that there was often also mistrust towards all those international NGOs and help convoys coming to the countries, but not with a clear communicated mission and inclusion of local actors as part of their teams. So they were in a bit alienated, which also led to a mistrust from the local population, saying, okay, what are they going to do? What is their mission? If you don't safeguard and ensure that the inclusion of stakeholders in those missions, and both also in the response mechanisms, is being anchored, then things have gone wrong in the Ebola response. So it's good to hear also that the WHO is now employing anthropologists and does that within the response teams as they are responding to the COVID crisis. The other thing which I think is important to mention here is that any misinformation and disinformation about the effectivity of the vaccine is, I mean, it's all over the continent, creating a lot of problems, I would say, and that is a serious issue that we need to address, because it's triggering civil unrest and it erodes social cohesion, whereas you need social cohesion and an uniform and agreed upon collective response to be able to tackle these crises.
Thanks so much, Peter. Richard, maybe you can jump in with your experience in the region.
And yeah, I think I'll just build on kind of the remarks that were made by Hild, Rudy, and Peter. And I think specifically in terms of the lessons that we learned from the Ebola response in Guinea, I think it had been mentioned that, given the kind of the existing distrust of the Ghanaian government, and especially from technical staff from the Ministry of Health or else coming from the capital to the Guinea Forest region, there was a very harsh, violent response by the local community to many of the health workers that were out there to sensitize the population on their prevention methods, but to help respond and deal with the crisis. And I think all three of the presenters, kind of mentioned that it's very important who's delivering the message, and that they understand and they are seen by the local communities as trustworthy and credible. And I think from that point of view, it raises the importance of using credible local voices, and especially in West Africa, whether that's traditional authorities or customary authorities or religious authorities, and then involving them in these campaigns to sensitize and raise awareness of the local populations, and also just to counter some of the disinformation that we saw taking place, in which unfortunately resulted in violence in the forest region of Guinea. So just to build on, and I agree totally wholeheartedly to the remarks of the other panelists. Back to you, Megan.
Thank you. Why don't I allow for just a couple brief remarks from Hilda and Maisha on some of the lessons you have gleaned, and then we'll start wrapping up. Thank you.
Sure. Thanks, Megan. I can jump in here. During the Ebola epidemic, data showed that mortality rates were higher in areas suffering from significant misinformation because people were less likely to comply with public health guidelines. And that came through formal challenges and in large part due to distrust. So in Liberia, Mercy Corps launched a community mobilization campaign that ultimately reached 2.4 million people, which is more than the total population of Liberia. And what our team members did is we worked with community organizations and leaders to combat rumors and myths and promote the adoption of behaviors and norms necessary to prevent the spread of Ebola. So even though we are not healthcare providers, organizations like Mercy Corps that are on the front lines, and particularly in conflict-affected, humanitarian, and fragile settings, really have a critical role to play. And I echo the points that were earlier made by Rudy and Hilda and others about cross-sector collaboration. For us, a chief message to the communities that we support is that we're not going anywhere. We were there before the COVID-19 pandemic began, and once the current emergency is over, whether that's Ebola or whether that's COVID-19, we will stay and we will continue to provide support to those who need it. So when that next emergency happens, we're able to help point to previous efforts as evidence of a purposeful, thoughtful, and sustained effort to help, and to draw on those lessons learned just as we've done before. Ultimately, and this theme of trust has come up over and over again, and that's how we build trust. And we know from the COVID-19 pandemic that where governments have been unwilling or unable to provide the kind of support that marginalized communities need, it's really civil society that's had to step up and fill those gaps.
Thanks, Hilda. Over to you.
Yeah, thanks. I just wanted to, as we're talking, there's another challenge that we saw with Ebola and that I feel is reproducing again now with COVID, and that I see as a continued risk with other pandemic outbreaks, is that in many countries what has happened is that there's all of a sudden a big investment and a big emphasis put on one major disease in a context where people have a lot of other health priorities that have remained unaddressed for a very long time. And that happened at a stage, especially in the beginning of the pandemic, where in a lot of the countries where we work, COVID wasn't yet a very real thing for them. COVID was something that was going on, that was affecting a lot of countries, us in the West, whereas they were having still the diarrhea, they were still having malaria, they were still having so many other diseases in a place where the health infrastructure was just so low and had been incapacitated for so long, whether we talk about DR Congo, whether we talk about some of the other places that we've been discussing. And what then happens when there's all this investment made in one particular disease, it just creates a lot of distrust of why all of a sudden attention on a disease that doesn't seem my priority. And B, and Rudy has referred to this at the beginning, it's when we bring in these type of resources can become a source of tension also in these contexts, right? Like who gets to work on the teams who are going to go out there, who gets access to these type of salary, what happens when you bring in big 4-wheel drives and this whole outroll of a big pandemic campaign in villages that have absolutely non-existent health infrastructure. So that's just something going forward. Like I understand, of course, from a global health perspective, we need to have that type of pandemic response, but I think we need to be a bit mindful of how that's perceived in communities where there are such long-standing grievances around their health needs. And maybe just one last point that we've also seen in Ebola and that we then saw again, unfortunately, during COVID, one particular challenge that we saw in DR Congo with the Ebola response was that the transport and the storage of the Ebola vaccines was done by the FRDC, the security forces, which is a force that is, of course, for serious reasons, very highly distrusted by a lot of the population. So that then kind of just increased, again, the distrust in the vaccine, and people just didn't want to come forward to the vaccination centers because the army was there. So that's just another point where, yes, there's a need for a national response and we have to rely on these type of national resources, but let's be mindful of how that's being perceived by communities in conflict.
Thank you. There's so many lessons to be gleaned. And I guess sort of my last question, and maybe Peter, you can kick us off. A lot of you have just mentioned the critical nature of localization and getting local actors involved, particularly local peace builders. I would be curious to hear your thoughts on what has the pandemic and the increasing conflict dynamics meant for things like including youth and women. So for the YPS agenda, the WPS agenda, and just the localization agenda more broadly. Have we learned the lessons from Ebola, and are we applying it now in our policies and programs? And in what ways has COVID, either undermined or advanced any of those three agendas?
Shall I go first? Maybe, yeah, on the, what I already mentioned in my first intervention is that I think that the pandemic has had disproportionate impacts on both youth and women. In terms of the youth, the economic impact and the downfall of lesser economic activity in various fragile and conflict-affected settings has led to potentially making them receptible for recruitment of organizations that have different agendas to pursue. Also, the enrollment in schools, we have seen the major impact that it had on countries like Uganda, where people have been kept, or young people have been kept out of schools for a very prolonged period, which of course is a very bad thing to happen, and which I think makes for some countries, and just building on the point Hilde earlier made, that in some countries you see the secondary impact even having a greater impact than the fact that there is a health crisis in itself. I mean, the figures of contractions of the virus in some of the countries were very low, whereas you saw the impact, the measures and the restrictions imposed on the population was having a severe impact, and the secondary impact was in that sense much more severe than potential health impact, which was foreseen to be potentially happening. But back to impact, I mean, what I also alluded to is that we have seen in our surveys and the research that we have done, an enormous spike in prevalence of gender-based violence, but also limitations of access to healthcare, disproportionately affecting women and young women. Whereas, I mean, if you look at it from the perspective, okay, we have been pursuing advance and pursuing to advance the YPS and WPS agendas, which also urge for a direct involvement and a meaningful engagement of these groups in also a response mechanism to these kind of crises, and involvement in processes where discussions are being taking place on how to respond in an inclusive and participatory multi-stakeholder fashion. And that we have not seen happening in many countries in where we have presence. I don't know whether Mayesha wants to also comment.
Sure, very quickly. I know we're just about at time, but maybe just one point to add to what was already said, which is, when we talk about, for example, the differential impacts on men and women, I think it's really important to understand that, when you're talking about gender-based violence, for example, really understanding the local context and distinguishing in different contexts, what are the trends, what are the impacts. So, when I was talking about our Clash of Contagions report earlier, in some communities, we were seeing an uptick in domestic violence and economic abuse, spousal economic abuse. In other contexts, we were seeing worsening sexual violence, right? So it's not the same in every context, and it can be really hard to identify accurate and sufficient information, but it's really important to invest and prioritize that kind of information in real time to the extent that it's, ethically possible to do that, because to simply say, oh, this has had, gendered impacts, but not unpack that, you can't possibly come up with effective and targeted policy interventions and responses. So that's the only thing I would add to the excellent comments that were already made.
Thank you so much. So we are at time. I just want to thank our panelists so much for being here and staying up late with us. For the folks across the pond, thank you so much to the audience for joining us. So much to unpack here. I think we hit on a lot of major themes about how we can apply the lessons from Ebola, how we can work harder to push for integration of conflict prevention and peace building in all health responses, and I would argue all government and institutional strategies, policies, and programming, such as the GFA strategy strategy, WPS strategy, et cetera, that others have referenced. And that we need to continue the hard work of calling for action and calling for this holistic, comprehensive approach. So really just want to thank everybody for spending some time with us this afternoon. Hope you stay safe and well, and look forward to continuing this conversation moving forward. Thank you.
Thank you.
Thanks, everyone.
Thanks,
Thank
everyone.
you. Have a good day.
Thank you.